Hello, I'm Dr. Frances Pitzilis. You thought driving was easy, but it's not. When you drive, quite a lot of processes have to be active and functioning the whole time. You've got to be able to think well, and you've got to be able to have good cognitive function. Along with that, you've got to have good vision, and you've got to have good motor skills and the ability to act quickly in case something happens. So from that point of view, a whole lot of drugs that can be prescribed by your doctor, as well as drugs that you may buy over the counter in the shop, can affect your function. And in particular, you're more vulnerable if you combine them with alcohol, and if you're older. So when we look at the statistics, here are the causes of accidents and perhaps why people who are talking about driverless cars may have a point. When looking at the factors that cause crashes, human performance factors cause 93% of crashes. Environmental causes contribute to 34% of crashes, and a vehicle problem like a mechanical fault contributes to 13% of crashes. So you can see that the human error is important. So medication can have a positive or a negative effect on driving. If you're depressed, you won't drive very well, so giving you an antidepressant will help you. However, there are some drugs that will make your performance worse. For example, 10 milligrams of diazepam for anxiety can produce more driving impairment than an over-the-limit blood alcohol concentration. A Montreal study of 224,000 drivers aged between 67 and 84 years of age found that those on long-acting benzodiazepines, tranquilizers like Valium, had 45% more collisions resulting in an injury. The interaction between over-the-counter drugs and alcohol can be a problem, and with age the tolerance of alcohol reduces. Then add medication and you have more risk. And then if you add multiple medical conditions and multiple medications, all of this risk increases again. So it's quite important to give yourself a minimum of 2 weeks to let any new drug settle in. And the message here is you probably shouldn't drink when you're on medications. Side effects of medications are the most common being sedation, nausea, impaired vision, hearing or concentration, dizziness, lowering blood pressure, fainting and loss of coordination. So, what are the tips for older drivers? Take your medication as instructed. You probably shouldn't drink alcohol. Always read the information leaflet. Ask a doctor or pharmacist how this drug will affect your driving. And in the day and age of walk-in clinics where the doctor doesn't know you, this becomes even more important. If you have more than one doctor, they should all be writing to each other to keep themselves up to date with what you're being prescribed. Never share your medication with other people. And be aware of over-the-counter medications that you can just go in and buy that might cause side effects or interfere with your prescribed medicines. So which are the medications that are risky? Sleeping pills, painkillers, cough and cold medications, diabetes medications, blood pressure medications, and any drug that could depress the central nervous system. As you can see, nearly everything that most people take can affect their driving. In addition to that, blurred vision can be caused by abnormal heart rhythm drugs, anticonvulsant drugs for epilepsy and antidepressants, as well as that, bone drugs, anti-anxiety drugs and painkillers for musculoskeletal pain. Reduced ability to see can also be caused by some AIDS drugs, acne drug given to teenagers and for other skin conditions. Now, cognition, that's thinking, especially attention, working memory, and spatial visual ability, and visual search, being able to scan, are all essential for safe driving, and they can be affected by anything that suppresses the central nervous system, like a sleeping pill or an anticonvulsant, alcohol, and illegal drugs. So a fast reaction is also required, and what will slow that down includes benzodiazepines or tranquilizers like Valium or oxazepam. It's probably better to use a shorter acting one like Halcyon, temazepam, imivane or clonazepam. Tricyclic depressants have 2.3 times a higher risk of crashing amongst older people. Antidepressants like Prozac have a 59% increase in crashes in one study because of impaired judgment, thinking and motor skills. A combination antidepressant like venlafaxine increases the crash rate by 78%, but it settles down within a week. If you combine antidepressants with benzodiazepines, the tranquilizers, the risk increases. Now that's all very well, but what about some of the other things that you don't think may cause an effect on your performance? And they include anti-nausea drugs, which can cause a 63% increase in crashes, diuretics that can cause confusion, drowsiness and lethargy, and antihistamines that you may just buy for your cold symptoms can significantly impair your performance, particularly the older ones. Even eye antihistamines can affect your likelihood of a crash by increasing it to 67%. So as mentioned, not only prescribed medicines but over-the-counter drugs can affect you. Add disease, illness and alcohol and you could be in big trouble. Older people are more at risk, and so the name of the game will be beware of combinations, alcohol, disease and age, and always ask your experts around you.